Hey everyone, and welcome back for another deep dive with us. We're going to be tackling a pretty sensitive topic today, one that's
hmm
been making headlines and, sparking a lot of debate online, the Canadian healthcare system.
Yeah.
We're going to be looking specifically at the story of Adam Burgoyne. He was a 39-year-old Montreal resident who passed away from an aneurysm after leaving the hospital because of a long wait time.
Yeah, it's a case that's really kind of ignited public concern.
Yeah.
It's really brought to light some of the challenges that healthcare systems around the world are facing right now.
Absolutely. And the sources we have today are an excerpt from a Newsweek article which details the event, and then also a Reddit thread with a ton of reactions. It's a great opportunity to not just look at, what happened, but how people are feeling about it. So let's start with Adam's experience.
Yeah, so Adam went to the ER complaining of chest pains, and he ended up waiting for 6 hours. He actually posted on X, formerly Twitter, kind of expressing his frustration with the whole thing.
Yeah.
He mentioned that he got an EKG, but he didn't get any blood work or X-rays. And tragically, he chose to leave the hospital and later passed away from an aneurysm.
Yeah. 6 hours is a long time to wait when you're in pain. And you
Yeah.
can really feel Adam's frustration in that X post. It's so heartbreaking to know what happened afterward. His online obituary kind of paints this picture of someone who was really full of life, sarcastic, quick wit, strong convictions.
Yeah, it's just devastating. And it's understandable why people are asking these tough questions about the Canadian healthcare system right now.
Yeah, absolutely. For those who might not be super familiar with it, could you just give us a really quick overview of how the Canadian healthcare system works?
Sure. So Canada has what we call a publicly funded healthcare system. It means it's primarily financed through taxes. It's also decentralized, so each province and territory kind of manages its own healthcare plan. One of the core principles is universal access. Healthcare is essentially free at the point of care, and it really prioritizes access over the ability to pay.
That sounds like a great idea in theory. But I know there's been a lot of talk lately about wait times being a major issue.
Yeah, that's definitely one of the challenges. In fact, the Fraser Institute, which is a Canadian think tank, just released a report stating that wait times for medical treatment are actually the longest on record in 2024, with a median wait time of 30 weeks.
30 weeks? Wow, that's almost 7 months. It's hard not to wonder if those delays are putting people at risk.
It's a valid concern, and it's definitely fueling a lot of the debate right now about whether the system is adequately funded and staffed to meet the needs of the Canadian population.
It's interesting. The Newsweek article also mentions that the U.S. for-profit healthcare system is also under scrutiny, especially after that assassination of the health insurance CEO.
Yeah, it's another layer to this whole conversation. It highlights how different the approaches to healthcare are in different countries. And it raises questions about, which system actually serves its citizens best.
Definitely some food for thought there. Okay, so we've got this tragic story, an overview of the Canadian system. Now let's dive into what people are saying about this. This Reddit thread that we have is really a hotbed of opinions and emotions.
It captures the raw feelings people are experiencing. There's anger, there's sadness, there's fear, there's calls for action. Some people are furious with the government, and some people seem kind of resigned to the situation.
It's a roller coaster reading through these comments. One user is straight up demanding accountability from elected officials, questioning why money is being spent on useless projects while people are literally dying waiting for care.
That comment reflects a very deep frustration with how resources are allocated, and a sense that the government is not really prioritizing healthcare.
Yeah, there's another comment that laments that politicians are only serving the wealthy and not the working class, which I think highlights a concern about inequality and, who's truly benefiting from this system.
Yeah, it speaks to that fear that access to quality healthcare is becoming more about privilege than an actual right.
And then there's this comment. This one's like a punch to the gut. Someone shared their own story of having a stroke that was misdiagnosed after a long ER wait. And it's terrifying to think how many people might be suffering in silence.
Yeah, that comment really underscores the very real human cost of these systemic issues and the fear that these stories are just the tip of the iceberg.
There's also this interesting comment from an American user saying, "My apologies from America for making our reality into your reality. We suck so bad we're making our neighbors suck too." It seems like there's this sense that the Canadian system is becoming more like the American one, which is currently facing a ton of criticism right now.
Yeah, that comment highlights a fear that Canada might be moving away from its core principles of universal access and kind of towards a system where cost and profit take precedence over patient care.
It's fascinating how one story can open up so many layers of discussion. So, what are some of the big takeaways that are emerging from this Reddit thread? What are some of the core issues that people are grappling with?
Well, the Reddit discussion really boils down to some fundamental questions. Is the Canadian healthcare system broken? Is it adequately funded and staffed? Are long wait times becoming the norm? And what are the consequences of that? And are there solutions? And who is responsible for implementing them?
Okay, so let's unpack some of these questions. We keep talking about long waits and triage. Could you explain how triage works and how that might have factored into Adam's situation?
Sure. So triage is basically a system used in emergency rooms to prioritize patients based on the severity of their condition. The goal is to make sure that those with the most urgent needs are seen first.
So, in a busy ER, someone with chest pain, like Adam, might have to wait if other people are deemed to have more life-threatening conditions.
Exactly. It's a complex process, and it's not always perfect. And it's especially challenging when you're dealing with conditions that are difficult to diagnose, like aneurysms.
Oh, yeah, it sounds like aneurysms can be particularly tricky to detect, especially in younger patients who might not exhibit the typical symptoms.
You're right. Aneurysms are often silent until they rupture, and they can be very difficult to detect, especially in individuals like Adam, who might not have presented with any classic warning signs.
So, even with a perfectly functioning system, there's a chance an aneurysm could be missed.
Unfortunately, yes. Medicine isn't an exact science, and even with the best technology and expertise, there's always the possibility of a misdiagnosis or a delayed diagnosis.
That brings us to the big question surrounding Adam's case. Would staying in the ER have changed the outcome?
It's the question that kind of haunts this whole case, right?
Hmm.
We can't definitively say whether further testing would have revealed the aneurysm, or if intervention at that point would have even been possible. It's a tragic situation. And it's understandable why people are looking for answers and demanding accountability.
But as you said, it's important to recognize the complexities involved, especially when we're dealing with conditions like aneurysms that can be unpredictable and difficult to detect.
Exactly. Well, it's essential to hold healthcare systems accountable and strive for improvements. It's also crucial to acknowledge the inherent complexities and limitations of medicine.
This is where it gets really interesting, because Adam's story is just one piece of a much larger puzzle.
You're absolutely right. This incident prompts us to examine the broader context and ask some tough questions about the strengths and weaknesses of universal healthcare systems like Canada's.
Exactly. And how does Canada's model compare to other countries, especially those with two-tier systems that allow private healthcare options?
That's a crucial point of comparison because different models have different implications for access, cost, and quality of care.
And thinking about the future, what are the potential implications of this incident for the direction of Canadian healthcare?
That's the big question. Will it lead to increased funding, structural reforms, or a move towards that two-tier system?
And that's what's so compelling about these deep dives, right? It's about exploring these nuances, understanding the trade-offs, and just engaging in thoughtful discussions about complex issues.
I agree. It's about encouraging critical thinking, questioning assumptions, and just considering the various perspectives at play.
So before we go any further, I want to pause here and ask you, the listener, what are your thoughts so far? What questions are coming up for you as we delve into this complex and emotionally charged topic?
Yeah, it's clear this whole thing has stirred up a lot of thoughts and emotions for everyone, and rightly so. This is about real people's lives and the systems that are supposed to support them.
Absolutely. And you know me, I always want to get to the so what of it all. Like, what does this all mean for us as individuals, as a society?
That's the million-dollar question, isn't it? I think one of the biggest takeaways here is the importance of informed dialogue. We need to move beyond these knee-jerk reactions and sound bites and really engage in some, thoughtful, nuanced discussions about healthcare.
I am with you on that. We need to listen to each other, understand the different viewpoints, and be open to exploring solutions that might not align perfectly with our own preconceived notions.
And that includes recognizing that there are trade-offs involved in every healthcare model. Whether it's publicly funded, privately funded, or some sort of hybrid system, there are always going to be benefits and drawbacks.
Right. It's about finding that balance, isn't it? Between access, affordability, quality of care, and meeting the needs of a diverse population.
Exactly. And that's why it's so crucial to engage in these conversations with an open mind and a willingness to learn from each other.
Okay, so let's zoom out a bit and look at the bigger picture. What are some of the key arguments for and against universal healthcare systems like Canada's?
Well, proponents of universal healthcare often point to the ethical aspect. They argue that everyone deserves access to essential medical care, regardless of their financial situation. They also point to potential cost savings, because a single-payer system can negotiate lower prices for drugs and services.
And on the flip side, what are some of the criticisms that are leveled against universal healthcare?
Critics often raise concerns about wait times for treatment and limited choice of providers, as well as the potential for government bureaucracy to kind of hinder efficiency. They also worry about the financial sustainability of these types of systems, especially as populations age and healthcare costs continue to rise.
It's like we're constantly trying to solve this equation, trying to figure out how to provide high-quality care to everyone, while also managing costs and ensuring timely access. It's a delicate balancing act, for sure.
And one that requires this ongoing dialogue and a commitment to finding solutions that work for everyone.
So where does that leave us? What are some potential pathways forward for Canadian healthcare, given the challenges we've been discussing?
Well, one option is to increase funding for the existing system, to try and address issues like staffing shortages and those long wait times we talked about.
That seems like a logical step. More resources could potentially lead to better care and shorter wait times.
Potentially, but it's also important to consider how that funding is allocated and whether it would actually address the root causes of these problems.
Good point. It's not just about throwing money at the problem. It's about using those resources wisely and strategically.
Exactly. Another option is to explore structural reforms to the system itself. Maybe look at ways to streamline processes, improve efficiency, empower healthcare providers to make decisions that benefit their patients.
I like that. Empowering those on the front lines could lead to more responsive and patient-centered care.
Right. And then there's the option of moving towards a two-tier system, which would allow for private healthcare options alongside the public system.
That's a pretty controversial topic.
It is. Some people argue that a two-tier system would create a more efficient and competitive healthcare market, leading to better care for everyone, while others worry that it would create a system where the wealthy have access to this superior care, while those who can't afford private insurance are left with a substandard public option.
So it's a complex issue with no easy answers, and it really comes down to what kind of healthcare system we as a society want to create and sustain.
Absolutely. What are our priorities? What are we willing to invest in? What trade-offs are we willing to make? These are all crucial questions that we need to grapple with as we think about the future of healthcare, not just in Canada, but globally.
You know, one thing that really struck me about this whole deep dive was the passion and the emotion in that Reddit thread. It's clear that people care deeply about healthcare. It's a fundamental human right, and it's something that affects all of us in such profound ways.
I agree. It's a topic that's very personal and often intertwined with our own experiences and beliefs.
And that's why it's so important to approach these conversations with empathy and understanding, even when we disagree with each other.
Absolutely. We need to create spaces for respectful dialogue, where we can listen to each other, share our perspectives, and work together to find solutions that benefit everyone.
Well said. So before we wrap up this deep dive, I want to circle back to Adam's story. It's easy to get lost in the statistics and the policy debates, but ultimately this is about a real person who lost his life. It's a tragedy, and it serves as a stark reminder of the human cost of healthcare challenges.
You're right. We can't lose sight of the individuals and families who are affected by these systemic issues. Adam's story is a powerful call to action. It compels us to examine the systems we have in place, to identify areas for improvement, and to work tirelessly to ensure that everyone has access to the quality care they deserve.
I think that's a perfect segue into our final thought for today's deep dive. We've talked about the challenges, the potential solutions, the different perspectives, and the emotional weight of this topic, but I want to leave you, the listener, with a question to ponder.
I'm all ears.
Okay, here it is. Given the increasing wait times and the strain on the Canadian healthcare system, what innovations or policy changes might help address these challenges while maintaining those core principles of universal access?
It's a challenge that demands creativity, collaboration, and a willingness to think outside the box.
It really feels like we're at a crossroads, doesn't it? People are passionate, they're frustrated, and they're looking for answers. What are some out-of-the-box ideas that could potentially address these challenges?
Well, one area that's gaining a lot of traction is virtual care. Imagine if Adam could have had a virtual consultation with a doctor before going to the ER. Maybe that could have helped to, assess his situation more quickly.
That's a really interesting thought. It could definitely help to reduce the burden on emergency rooms and, potentially speed up that whole triage process. Are there any other innovative solutions out there that are being explored?
Oh, absolutely. There's a growing focus on preventative care and early intervention these days. Think about it. If we can better manage chronic conditions and promote healthier lifestyles, we can potentially reduce the need for emergency care down the line.
That makes a lot of sense. It's like addressing the problem upstream, right? Preventing those health crises from even happening in the first place.
Exactly. And then there's this whole area of data analytics and AI. Imagine if we could leverage these technologies to optimize hospital workflows, predict peak demand periods, and allocate resources more efficiently.
Wow, that sounds almost futuristic. But it also feels like it has the potential to make a real difference. Can you give me an example of how that might work in practice?
Sure. Let's say an AI system analyzes historical data
Yeah.
and it identifies patterns that indicate higher risk of heart-related emergencies. On certain days of the week or during specific times of year, hospitals could then use that information to proactively adjust staffing levels
Mhm.
or implement targeted outreach programs.
That's incredible. It's like using data to anticipate and prepare for those surges in demand, which would help reduce wait times and just improve overall efficiency.
Exactly. And these are just a few examples. There are so many brilliant minds working on innovative solutions to address these healthcare challenges. It's a time of great potential, and I'm optimistic that we'll see some significant progress in the years to come.
That is definitely reassuring to hear. It's clear that, this isn't a simple issue with easy fixes, but it sounds like there's a real push for change out there and a willingness to explore these new approaches. What are some of your final thoughts for our listeners as they continue to, think about this whole complex issue?
I think it's crucial to remember that healthcare is ultimately about people. Behind every statistic, every policy debate, there are individuals like Adam and their families who are directly impacted by these challenges. So let's keep that human element at the forefront of our minds as we engage in these conversations and work towards a future where everyone has access to quality care.
Beautifully said. And to our listeners, thank you for joining us on this deep dive. We hope it sparks some new ideas for you and gave you a deeper understanding of the complexities surrounding the Canadian healthcare system. Remember, your voice matters. Continue to engage in these conversations, advocate for change, and be a part of the solution.
It's been a pleasure exploring this topic with you.
Until next time, stay curious and keep diving deep.